So for our patients, as an acupuncturist, evaluation is actually a very important part of the patient's journey. It is the first part of the patient's journey, actually. And everything that we do for the patient depends on the correct diagnosis. So if you can diagnose properly, that means you can identify the right pattern. That means you can choose the right treatment principle. And when you have all of that right, your patient gets better in an efficient manner of time. And that's truly helping your patient. So that's what makes evaluation such an important part of your patient's journey. So today, let's break down the entire evaluation process from soup to nuts. So in our evaluation, the first thing that we start with is something called observation. We are going to be observing or looking at the patient's face, their tongue. We're going to look at their body posture. Now, from inspection, we move on to the next pillar, which is called touch. So in TCM, we touch or we palpate. So we feel the pulse, we palpate the channels. Now next comes sound. So in TCM, we call this listening and smelling. So we're paying really close attention to our patient's voice, their breathing. We might even take in some body odors. The last pillar that we have is called the asking pillar. So this is where we ask our 10 questions, which we all know it's not actually 10 questions, but basically we're talking and asking our patient through a very thorough history taking.